Mr. Glassbeagle, can you please call roll to establish our quorum?
Yes.
Here.
Here.
All members are present.
Perfect. Thank you so much. Good morning, and thank you to everyone for joining us on WebEx. Pursuant to the provisions of Governor Newsom's Executive Order N29-20, dated March 17th, 2020, neither committee member locations or a public meeting location is provided, and public participation may be through teleconferencing. My name is Leah Tate, and I'm the chairperson of the Outreach and the Communications Committee. And this is my first meeting as the chairperson, and it's also my first time facilitating a meeting on WebEx, so I apologize if it might be a little rough around the edges. This is our first meeting of 2020. Our last meeting was on May 17th, 2019, so it's great for us to meet again and regain our momentum. We have a new addition to this committee, Dr. Shaconda Rogers, and I'd like to welcome her to her first meeting, and I look forward to having her fresh insight on the committee. And Dr. Rogers, I know this is putting you on the spot, but would you like to briefly introduce yourself and make a comment, please?
Sure, absolutely. Dr. Tate, thank you so much for the warm welcome. I am delighted and honored to be part of the Outreach and Communications Committee. I'm looking forward to learning about what you all have been doing thus far, and I'm excited to figure out ways to make a meaningful and useful contribution to the committee moving forward. So thanks again. Glad to be here.
Thank you. We're happy to have you. So first off, we're going to go into public comment for items not on the agenda. The committee may not discuss or take action on any matter raised during this public comment section, except to decide whether to place the matter on the agenda of a future meeting. Mr. Glassbeagle, can we open up the comment for our public, please?
Yes, so if there's any members of the public that wishes to make a comment, you can raise your hand or just advise that you would like to make a comment.
I have done. Really quick, can we call the roll?
We did.
We did. I'm sorry. Sorry about that.
Okay. Looks like there is no request for public comment or
Perfect.
No comment to be provided.
Okay, then we will move on to, let's see, approval of our last meeting minutes, which were on May 17th, 2019. Can I get a motion to approve the minutes, please?
Dr. Rogers, you're the only one that you have to be the one to motion.
Okay, I had a question about that. I didn't know if I could make a motion since I was not present for that meeting.
Yes.
I'm the only one that can make the motion. Then I move that we approve the minutes from the May 17, 2019 Outreach and Education Committee meeting.
And I will second that motion.
This is Noreen. I do want to quick. I mean, the motion is made and seconded, so we're fine. Yeah. I do not go necessarily prohibit a committee or board chair from making a motion, but that's up to you whether or not you would like to follow that format.
Oh, okay. I had no idea. So I'm happy to do that going forward. Okay. Is there any discussion, Dr. Rogers?
None. Thank you.
Perfect. Do we need to call roll for the vote or?
No, but you need, well, you do, but you need to ask for public comment first.
Perfect. Okay. Any public comment on our minutes from May 17th, 2019? Mr. Glassbeagle, can you open it up, please?
Yep, it is open for anybody that would like to provide public comment.
I am seeing no comments.
I agree.
Okay, perfect. So we'll go ahead with the vote. All in favor of approval of the meeting minutes dated May 17th, 2019. Can we say aye, please?
Aye.
Aye. Thank you.
Perfect.
Moving on to the strategic plan action plan update. I will turn to Ms. Sorick to discuss this topic, please. Ms. Sorick?
Hi there. Included in the meeting materials is the strategic plan update. This is an ongoing update item that is provided to the Outreach and Communications Committee, and then it's reported out for its progress at the full board meeting. I met with management and we updated all of our timelines. You'll see statuses in red. Those have been items that have been moved, typically for reasons of either we're waiting for legislation, regulation, impacts from COVID, or vacancies. So that kind of gives you a broad overview of why some of the status items have been moved out or pushed out. And then some of them have been completed. So just an update on that. And I'm happy to take any questions that either of you might have.
This is Dr. Tate, and I have no questions.
This is Dr. Rogers, and I have a few questions, just getting some clarification. On the strategic goal areas, I see goals 1 through 6, licensing, continuing professional development. Question about goal number 5, it says outreach and education, and I was wondering if that should be changed to outreach and communication to be consistent with the name of this committee, or if it should stay outreach and education.
That's a great question. Typically, when the board adopts a strategic plan, it's kind of a snapshot in time. At that time, we talked about whether or not to change the names of the board members, staff that was listed on there. But as I mentioned, I think it's a good snapshot in time for when the board ratifies the strategic plan. And then that's kind of a living document with the changes being made to the status. Before you know it, we're going to be in another planning session with Solid and writing a new strategic plan. So this is kind of where we're at for this 5-year strategic plan. And then going forward, we'll probably look at making the changes to the goals and whatnot.
Okay, great. Thank you so much.
Sure.
I have a couple of other questions that I highlighted as I was moving through the document. May I ask a question about goal 3, policy and advocacy? This is under the telepsychology regulations, section 3.3. I was curious about under major tasks, it says train all staff on new regulations. Can you speak a little bit about what the new regulations are, or is this encapsulated in the snapshot that you were just referring to?
So this would be so next week we have a regulatory hearing on our telehealth regulations. Once that is passed or hopefully approved, then we'll need to train the staff on how those regulations are interpreted so that when we get phone calls or inquiries from licensees that we have those answers. So that's kind of what that address is there. Does that answer your question, Dr. Rogers?
Yes, it does, Ms. Thorick. Thank you so much.
Sure.
Trying to see if there were any other questions that I had. In section 5.4, where it discusses analyze resources allocated to outreach and education, just curious under status, I didn't know what the acronym BCP stood for.
I'm sorry, that's definitely government speak. So that's going to be a budget change proposal.
Okay.
And that's a document that we put together working with the Department of Consumer Affairs. And it goes through Business Consumer Services and Housing Agency, and then ultimately Department of Finance takes a look at that. And then if it's approved, we go to the legislature and they ask us questions, and then we get the legislative authority to go through with that request if it's approved. So that's typically our way of asking for permission to take money out of that surplus fund, that savings account, and then put it into our operating budget. And we use that for utilization of positions typically.
Okay, great. Thank you.
Mm-hmm.
And one final question. In section 5.7, develop campaigns to communicate what the board is. Just curious about what the campaigns are currently.
So this was an idea we came up with in our strategic planning session, and it was a byproduct of the feedback that we got from our SWOT analysis, our strengths, weaknesses, opportunities, and threats that we put out to our stakeholders. And what we were seeing was that, Dr. Linda Crow, you're on the line, so you might be able to add to this. As we discussed it during the planning session, some people are not quite clear on what the board is and then what the professional association is, and each of our roles. So from the feedback we got from the survey and in our discussion at the strategic planning meeting, we said, well, why don't we work together and try to articulate how we're different and how we work together, so that way people have a better understanding.
Understood. Thank you so much.
Sure. Dr. Linda Crow, did you have anything to add to that, if you remember that discussion?
No, I think that was it. It reminds me that we need to do that.
We got a couple of years, so we're still on schedule.
Okay. I think it was such a brilliant idea, don't you think?
Absolutely.
Thank you.
That was my final question.
Perfect. Thank you, Ms. Sorick and Dr. Rogers, for your comments. I'd like to open it up to the public for any comments regarding the strategic plan update. Mr. Glassbeagle, can you open that up?
Yes. Does any members of the public want to provide public comment on the board's strategic plan?
I'm
Seeing
seeing
none.
Okay, perfect. I'm seeing no comments.
I'm sorry, Dr. Tate, I just want to ask Mr. Glassbeagle a quick question. Is
Sure.
everyone able to unmute themselves? They have their power to unmute
Yes.
themselves? Okay, so you're not in control of that, so nobody has to use right now the raise hand or chat feature?
Correct.
Okay, so hopefully, is there anyone who isn't clear on how to unmute themselves? I just want to make sure that we're allowing public sufficient time for people to get themselves unmuted or know that they have the power to unmute themselves.
Thank you, Ms. Marks.
Great point. Yeah.
I'll wait a little longer. Okay, I don't see any comments. Is that enough time, Ms. Marks, do you think?
I think so. Hopefully somebody would by now have indicated that they're not clear on how to use the feature, because I think you can use the raise your hand and chat feature at any time, right? You're not necessarily having to open that up. Is that true, Mr. Glassbeagle?
Correct. Yeah, it's they just have to unmute themselves and say, I have a comment.
Okay, terrific. Thank you so much.
No problem.
And I'm happy
Thank
if
you, Dr. Tate.
Okay, I was gonna say I'm happy if anyone in the public needs to interrupt us or me, and I'm happy to allow for the comment. So this brings us to number 6, the updates on website focus group. This is a follow-up And this is an information-only agenda item, and I'll ask Mr. Glass-Steagall to present this topic.
Happy to present. Thank you very much. In your meeting materials is a memo updating the status of the website focus group through 2016 to present. The board staff worked with the solid planning division of the Department of Consumer Affairs to hold a website focus group meeting to really plan out what would be the best changes to make to the website, kind of an both in things that are immediately implementable and then more long-term goals. Staff worked to make anything that was immediately implementable done. And due to the COVID pandemic, we've had to wait to address the items for the larger items under the 2020 restructuring, and which we will begin again once all staff return to the office and vacancies are filled. Happy to answer any questions.
Any questions from the board members, Dr. Rogers?
No questions here. Thank you.
Any comments from the public? And I'll wait a few extra seconds. Please feel free to unmute yourself and ask your questions. I'm seeing no comments from the public. Again, this is just an information-only agenda item. And moving on to number 7, this is our social media update and another information-only agenda item. And Mr. Glass-Steagall, would you like to take it away?
Happy to take it away. In the meeting materials, in your meeting materials, we have the social media update, which has the total likes for Facebook, as well as likes over time, Twitter followers, and people that we follow, as well as tweets. And then we have updated numbers of viewings for the 2020 and 2019 board and committee meetings that were webcast. And then there's the graphs that show changes over time below. If you have any questions, I'm happy to discuss further.
Are there any questions from our board member, Dr. Rogers?
No questions. Thank you.
Any questions from the public regarding this agenda item? And I'll wait a few extra seconds. Please feel free to unmute yourself and ask your question. I see no comments from the public at this time. Let's move on to agenda item number 8. This is the website statistics update. This is also an information-only agenda item. And Mr. Glass-Steagall, please.
Thank you very much, Dr. Tate. Included in your meeting materials is our website update, which involves the top viewed web pages on our website from January 1, 2020 through September 8, 2020. And in addition, I have pages broken down per quarter from the same time period. And as you can see, the top 5 pages, we have the link or the web address of the page and also what the content is on the page for easier understanding, the number of views, and then the top viewed web pages per quarter. Those are stagnant and remain for every meeting that we present this on. The only addition and the only thing that really changes is which newsletter we're providing and the COVID page, which was added by me during making up this materials. So I figured it would be helpful to. I'm happy to answer any questions.
Are there any questions by our board member, Dr. Rogers?
No questions. Thank you.
Thank you. I'd like to open it to the public to ask any questions regarding this agenda item. Please feel free to unmute yourself and ask your questions.
Question or comment?
Thank you. Question or comments, please. I see no questions or comments from the public, which brings us to agenda item number 9, the update on our newsletter. I believe Ms. Sorick is going to give us this update on the informational only agenda item. Or Mr. Glass-Steagall, I could be wrong.
We have it from Ms. Sork, but I'm happy to provide the update. Attached in your meeting materials is the board's fall journal. The winter journal will go out December 2020, and as Dr. Tate stated, this is informational purposes only, and happy to answer any questions.
Any questions from our board member regarding the journal? Newsletter, sorry.
No specific questions. I would just like to say how heartened I am to see the section dedicated to Mr. Thomas and his work with the board. Thank
Yeah, I thought they did a nice job with that as well.
Thanks.
I would like to open it up for public questions or comments regarding the newsletter. Please feel free to unmute yourself and state your question or comment, please.
Yes, this is Dr. Imos from CDCR. I actually had quite a few reactions, not only within CDCR from our psychologists, but also outside who had apparently heard about the newsletter. It's maybe particularly now, while many of us are telecommuting or kind of cut off from each other, even more important. So thank you. I just wanted to emphasize the importance of this newsletter and the feedback that I've gotten in the past few months.
Perfect. Thank you so much. We put a lot of time and effort into getting it out, and you're right, everyone is a little bit more isolated at this time. So I appreciate the comments. Any other public comment or questions? Okay, let's move on to agenda item number 10. This would be our outreach activities update. And I believe this is also an informational only agenda item. Mr. Glass-Steagall, please.
Thank you very much, Dr. Tate. Yes, this is an informational only item which lists out the current outreach activities. Currently, there are no board or DCA approved outreach due to COVID. Other outreach, we have Dr. Harpsheets who will speak to interns at the San Bernardino County Department of Behavioral Health about her career path and her general experience as a board member. And then the board currently has a request that was approved by the Department of Consumer Affairs to have staff and legal and a few board members attend ASPPB's annual meeting, which is being held virtually this year. And that request was approved, and we are currently working on the basically the purchase order so we can pay for it. And I'm happy to answer any questions.
Thank you for the update, Mr. Glass-Steagall. Any comments from our board member?
Yes, one quick question. Just curious, after your attendance at the ASPPB meeting, will you share any pertinent or relevant information that you gained from the meeting, perhaps at the November Board of Psychology meeting?
Ms. Sork might remember whether or not we have this agendized to discuss at the meeting, but general practice is for our first opportunity after something to happen where we ask for kind of an update or any kind of a feedback for how it went. And I think Ms. Sork has unmuted herself, so she probably has something to add.
I apologize. I had completely lost connection to the meeting and I just got back in. So sorry about that.
That's okay. Did you want to add whether or not do you know if this agenda item, the ASPPB meeting, is agendized for the November meeting? So that way we can provide feedback. I can't pull up the agenda right now without losing our page.
I know we'll have the updates on communications or activities. This item is being put onto the November meeting agenda. Can you all hear me? Just
Yes.
checking.
Yes.
Okay. Because it's like cutting out for you guys for some reason. Anyway, yeah, this item number 11 will be on the November board meeting agenda, and Mr. Fu will also have an opportunity during the president's message to talk about, generally speaking, topics that were covered at the ASPBB meeting.
Fantastic. Thank you.
Did that answer Dr. Rogers, your question enough?
Yes, it did. Yeah, no further questions. Thank you.
Okay, I'd like to open it up to the public for any questions or comments regarding this item. Please feel free to unmute yourself and make your question or comment.
So, hi, everybody. This is Jackie Horn. I'm sorry, but and this is going to sound like a bad question, but I just want to know where you are on the agenda.
Your timing is impeccable. You are the next item, so.
Wonderful.
Perfect.
So,
Hold on a minute, and you will be up. So I see no public comment for agenda item number 10. So I'd like to move on to agenda item number 11, which is the updates on communications and or activities of the Association of State and Provincial Psychology Boards, ASPPB. And as she has introduced herself, this is Dr. Jackie Horn, who's going to provide us with that update. And welcome.
thank you very much. I'm glad to be here among those I still consider my peeps. But anyway, I guess I particularly want to talk about, and y'all let me know what you want to hear about, but I want to talk about the upcoming annual meeting. Because it's virtual, I'm really hoping that everybody on the board is able to come. And, just to let y'all know, all board and all board staff everybody on the board is a member of ASPPB. And anybody on the board or board staff or the board attorney also can all come to ASPPB meetings. So I'm hoping that because it is virtual, that we'll be able to come and see what's being talked about, hear what's being talked about. So I don't know if y'all have received the agenda for the ASPPB annual meeting. Have you?
I know Antoinette received it and has forwarded it to staff that we are requesting to attend, including board members that are being requested to attend.
Okay, great. Y'all can see that the theme of the entire meeting is COVID, and what changes have been made to orders or things like that have allowed things to continue or happen or occur during COVID that haven't been possible before. So it's a look at that, and then also a look at what adjustments have worked, what adjustments haven't, what kinds of things might we want to think about going forward as licensing boards, et cetera, et cetera. And we're going to focus primarily on how education and training has changed, how psychology practice has changed, and how regulation has changed during this time. And then we also want to look going forward. What do we make out of this that we've learned from this? and make adjustments, perhaps in regulation going forward, or also what kinds of things will be helpful to licensing boards going forward. So let me give you an idea of something that's happening. There's been a change in psychology training because of COVID, and that's across the United States and Canada. And as a result, a lot of things that are occurring are having to occur through telemeans, I'll say, telepsychologically. So supervision that's occurring, seeing clients, or so Antoinette just asked me to forward the agenda, and I can do it after I quit talking. Is that okay?
Absolutely.
Thanks. I can't do so. So anyway, there have been a lot of changes in training in particular, but I've also seen on your website and a lot of other jurisdictions' websites that the accommodations that they've made to, for example, continuing education and how that has to be, or how that can be satisfied during this time and all that kind of stuff. So one of the things, ASPPB developed a work group that is all these three areas, and that work group has come up with, we started with education and training, some forms for trainees and supervisors to fill out that of changes, essentially changes that were made, how certain things were met, how they were able to meet their training requirements, and how they were able to meet their supervision requirements, all that kind of stuff during this period. And that will be for last year, people who were affected last, say, academic and training year, and this coming, which has already started, this coming academic and training year. And it's forms that supervisors and trainees can fill out, and we're going to have those for all licensing boards, so that if it will help you in your review of people's credentials, because it'll be in the same order all the time, and those forms will describe specifically what changes, what accommodations were made to COVID, but how the work was continued. So we've just completed those. They're actually going to be sent out to the board administrators listserv and to the board chairs listserv. And, so Sayron and Antoinette can make those available to all of you. They're not a secret. We want everybody to see them, because we're hoping that the licensing boards will say, yeah, we can use these in evaluating credentials of people, if it doesn't look like it typically looks. So one thing that'll be coming out to you, like I said, to those listservs soon, and then also talk about it at the annual meeting. So it's the going forward piece. The next thing we're working on are forms for people who are already licensed. So changes in practice that have occurred as a result of COVID. And we're also wanting to create some forms that will be useful, again, for license to use it. They're evaluating folks for, like, they may submit those forms, I don't know, because so many of our folks do their, at least they're getting relicensed, that all occurs online. But I don't know, maybe for initial license, or some of these forms would be helpful. Initial licensure, the educational forms will be helpful, or should be helpful. But for folks who are already in practice, then I don't know if this would be a supplement that y'all might use, or that would be helpful. But that's what we're hoping, that they'll be helpful to licensing boards primarily to make your job easier. So that's the annual meeting. I'm really hoping that everybody, as many people who can will be able to come, and it's over 2 days, October 16th and 17th. That said,
Warren, I'm not sure if you guys are using like a Zoom platform or what kind of platform you're using, but I'm wondering if it is going to be recorded. And for those that aren't going to be at the actual live interactive meeting, that if they can view the presentations after the fact, that would be amazing.
yes. So first of all, we sent out the agenda book so that it will include all the PowerPoint presentations and stuff. But it is a Zoom platform, but we are also recording it. So yes, that will be available, and it will probably be available. And so I want to suggest to all our board and staff to sign up for the ASP so that you can be a member of ASPPB. Well, that's particularly our board, because then you'll have access to the members only section. And I believe that includes all board members, all staff, board attorneys, and all of those people have access to the members only section of ASPPB.
If you could possibly ask, and I only am asking this because I've been on probably 1,000 school Zoom meetings where after they've been held live interactive, the school sends out the link to watch the recorded session. So if someone misses it, they can see it. So if it's not something that has to be through the website, through that platform, but through like the recorded link for the meeting, that would be really cool. I don't know if that's something you can ask ASPPB about, but that would be great as well.
Ask ASPPB about it. I'm not sure they will because, but I'll ask them. But again, because the meetings are for members only, and then liaisons are invited people. And so it's not just general information going out. So I'll check and see if it can be just provided on a link, and then you can forward that to, or give the board access to that, or the staff access to that. Happy to do that.
That would be awesome.
Yeah.
Thank you.
Any other questions? Y'all want to know about what ASPPB's doing otherwise, or what would you like me to focus on?
I think you did a nice job of giving us the update of what's going to happen with the upcoming conference.
Yeah.
So, I think that's where everyone's head is probably at right now, focusing on this near future. And it'd be nice if we could get as many people to attend.
Great. That'd be just great.
Let me.
I always want California to be there, as you know. So.
Absolutely. Dr. Horn, are you done with your comments? Because I'd like to open it up if possible.
Absolutely. Whatever y'all want me to talk about or ask about, I'm happy to answer.
Any comments regarding Dr. Horn's presentation from our board member?
Hi, Dr. Horn. This is Dr. Rogers. Thank you so much for your presentation. I am excited to hear about all of the new developments, and I'm particularly interested in the education and training component, and also the practice component. So it looks like what you all have planned is going to be really useful and informative, and I hope people can take all of the information back to their respective states and make some updates. Thank you very much.
Thank you. And let me just kind of add to or comment on what you were saying there. The you know, is an organization of all the licensing boards in the US and Canada. And so anything, the meetings are generally focused specifically on information that we hope will be helpful to regulatory bodies and things that, you know, jurisdictions can take back and use that will be helpful in boards' missions, which is public protection primarily. That's the reason that boards exist. So everything we do is for that and what we're aimed at. So the one reason I keep what I want to say, hyping it. I don't know if hype is exactly the right word, but one reason I really keep talking about ASPPB is because, especially right now, and I don't know how much y'all have seen this or how much we've seen this in California, but there's a huge anti-regulatory movement that's been even increased because of COVID, where people are, our jurisdictions, some of them are kind of relaxing some of the their standards that they wouldn't allow before, and now they're allowing. And so this has really given a more of a voice to these anti-regulatory voices. Well, if we don't need it now, why did we need it then, kind of thing, you know? So I think it's very, very helpful. The things that I think ASPPB tries to do is really think about reframing that, because this is not about keeping people, or I'll say keeping good people out of the profession, but it is really to help all of us create as much as we can. I think consistency in what we think is good practice and what we think is ethical practice and what we think is the best practice that allows our consumers of psychological services to be best served. So that's really always the focus for ASPPB, helping jurisdictions do that. So Dr. Rogers, but I just wanted to kind of highlight
that's incredibly helpful. And I think because there is so much uncertainty right now because of COVID, lots of jurisdictions and regulatory boards are, trying to figure out the best way moving forward. So I really appreciate ASPPB in their efforts to create some structure and some consistency in what is a very uncertain time. So this information is so incredibly important. Thank you.
Sure.
Dr. Horn, I'd like to open it up to the public, and so please stay on the call so you can answer questions or comments. So, so any public members that have public comment, please feel free to unmute yourself, and Dr. Horn is available.
Hi, this is Dr. Joe Lindercrow. I'm the CEO at the California Psychological Association. Good morning again, everyone. Good morning, Dr. Horn. I have a general question. I wondered if there was a plan at the ASPPB meeting to discuss the EPPP and the impact that COVID has had on those individuals who are trying to take the exam. We have heard so many comments from our members and, recently graduated individuals who have had so much difficulty scheduling the EPPP, paying for the EPPP. And so I just wondered if this was going to be a part of the focus on education and training at the meeting.
The EPPP2 or the EPPP2 is going to be talked about at the meeting, but if it's okay, let me if I can answer your question now about or the kinds of things that I'm sure you're hearing, because we've certainly been hearing them too. So this will also be for the board. It's, I think, information you can give people if you haven't already. But the first thing that had to happen was that we had to get psychology, because in the test centers, the first thing that had to happen was we had to get psychology labeled as an essential profession once COVID hit. And so we did that. So, there was a brief period of time and nobody could take the EPPP. But once we got the psychology listed as an essential profession, and that was pretty quick, but I'd say it wasn't accessible, and those of you on the board staff can maybe answer this better, but it was definitely a few weeks that nobody could schedule to take the EPPP in psychology, for psychology. But then once we were labeled as essential, the testing centers have opened up to us, but they opened up not in full capacity, because they have to maintain social distancing throughout. And psychology isn't the only group. The Pearson centers, like everybody's licensing exam goes through the Pearson Center. So there are a lot of different folks. So the scheduling windows, I think, have increased because they're only operating at about 50% capacity to maintain social distance. So that's another thing. So I know people have had concerns. I'm not going to be able to get licensed within that window, or I'm not going to be able to take the exam within my allotted window. So I'm not sure. I would guess our board has had to deal with that too. But what SPP has also done, or what Pearson has done, we worked with Pearson to contract with some non-Pearson testing centers. And that will be particularly in rural areas, in states, and then in Canada also, that doesn't have as many Pearson testing centers, where the EPPP can be given in those centers as well. And so those things should be able to be found out all through when they go to sign up to take the EPPP. I guess a question I would have. So it seems to be running okay now, and people are able to go ahead and schedule within, I think is it a 3-month window? I think people are able to schedule within that window. You might have gotten some stuff right from the earlier part of this. I'm not sure. Does that answer?
Yeah, well, thank you very much. I just wondered, I just wanted to be sure it's still on everyone's radar, I guess, as we see that this is going to be continuing for quite a long time, apparently.
Yeah, for quite a long time. I know this is going through the end of this year. I mean, so I don't know when the Pearson centers will back up at this point in time to full capacity.
Thank you for your comments, Dr. Linder-Crow and Dr. Horn. Is there any more public comment at this time? Please feel free to unmute yourself. I don't see any public comment. So I would like to thank you, Dr. Horn, for taking time out of your schedule to give us that very thorough update on what's upcoming. Perfect. So we're going to be moving on to item number 12. And this is For Your Peace of Mind, A Consumer's Guide to Psychological Services. This is a publication that the Board of Psychology puts out. And as stated in the agenda, this project regarding updating this document has been postponed until 2021 due to limitations of staff and in-person meetings. Ms. Sorick, did I cover this item, or do you have any more comments?
You covered it perfectly. Thanks.
So no action is occurring at this time. Do I have any comments from the board member regarding agenda item number 12?
No comments. Thank you.
I'd like to open it up for public comment regarding agenda item number 12. Please feel free to unmute yourself. I'm seeing no public comment. Moving on to agenda item number 13. This is addressing cultural diversity and access to psychological services in California. And prior to having Ms. Sorick go into detail regarding these next few agenda sub-items, I wanted to provide some background regarding why these topics are on our agenda. As a result of the recent national, state, and local concerns with diversity, racism, equity, and a movement of organizations toward looking inwards at ways to improve, the Board of Psychology is no different. Our executive officer, Ms. Sorick, and the Board of Psychology feel strongly about ensuring the board has actionable items that will help address cultural diversity, access to services, and equity with our licensees, stakeholders, and consumers. With that preface, Ms. Sorick, would you like to go ahead?
Sure. And I didn't know if, let's see. Yes, that's good. And Mr. Glass-Steagall, that's good scrolling down. So just wanted to address that so everybody can see the sub items there. So kind of in response to, things that were going on in our state and our country, Mr. Fu and Dr. Tate and myself had a call, and we kind of brainstormed, and as chair of Outreach and Communications Committee, we talked to Dr. Tate about what could the board do and where was there a nexus in our fundamental mission to address some of the issues. So this was the preliminary list that we came up with that had a kind of direct nexus to what the board does. And so those have been laid out. Item A, the update on continued professional development regulations and implementation plan to produce written materials, including cultural diversity and social justice requirement. This is a matter of waiting for the regulations to proceed. The continuing professional development regulations, we will be conducting a hearing at the November board meeting. And then once that hearing is conducted, the Office of Administrative Law will consider the regulatory package for approval. And then we will discuss how we can implement what that requirement for cultural diversity and social justice looks like for the 36 hours for purposes of renewal. We do have a former board member, Dr. Gallardo, who was kind of heavily invested in this language when the board started creating the regulatory framework for this item. So there are opportunities for, I think, guest input from him and others in the community that provide this kind of training so that we have a framework to kind of give guidance to licensees on what we're looking for to meet that requirement. So that is an item to follow up. And the next item is increasing stakeholder engagement. And this is really looking to the community and some of the special interest groups for how we can partner with some organizations on messaging and communication. So that is an item in there. C is engage Department of Healthcare Services regarding Medi-Cal reimbursement rates. We've reached out to the department about what the rates are, and pretty amazing how low those are, and how that impacts access to psychological services in California, and certainly for those that have challenges with ability to pay for those services, as well as incentivizing individuals in the licensing community to provide those services. So we have that follow-up call that I'm hoping to schedule, just waiting to hear back from DHCS on that process, how they set the rates and what kind of regular review happens to determine what those rates are. And I'm just going to go through this, and then if anyone has any questions from the committee or the public, we can go from there. D is engage substance abuse and mental health services regarding federal initiatives addressing equity. I did reach out to SAMHSA in regards to this item, and have asked for them to let us know and make us aware of any initiatives or educational direction on this item. This is something that it looks like right now the big focus for SAMHSA is implementing the 988 line, which is their suicide prevention hotline. Works very similar to a 911. The regulations were just approved, and now they're at the phase of working with the mobile service providers, et cetera, to get that program up and running. And then the last item is the digital divide. How does the digital divide impact access to telehealth? And this is something that I know Dr. Kasuga has mentioned several times. For those that have an inability to pay or have access to services, and especially while telehealth is really the only game in town for times like right now, are we able to reach all those that need services? So those are the items that we discussed, and ways in which the board can have communication and discussion with agencies that have a direct involvement with each of these items. So that is the presentation, and I'm happy to take any questions.
Are there any questions from our board member today?
Yes, I have one question, and thank you, Ms. Sorek, for the update. That was incredibly helpful. I have a question about the continued professional development regulation. Is the thought that if licensees are to take a cultural diversity or social justice course or training, is the thought that it would be a one-time requirement, or would this be something required for each renewal cycle?
This would be for each renewal cycle. And if you can,
Okay.
Mr. Glassbeagle, can you pull up on your end the regulations? And I don't know why I'm forgetting if it's a 4-hour requirement or an 8-hour requirement.
I can, but I'll have to stop sharing this agenda item, and it'll take me a few minutes, but I can pull it up.
Okay.
One second. So your screens might go blank, everybody, just so you know. Let me know what happens. Like right now.
Blank. We're waiting.
Blank? Good. Yeah, that's good. You should be seeing this.
Yes.
Yeah, you have it up.
Wonderful. Okay. You know what section, Ms. Sork, at all? And I can find it.
Can you do a search?
I wish I did. Yeah, if you could
I
do
don't
a
know
search.
if it works on here without it being 88, but it was oh, and I can't see what I'm typing because I have another box in the way that I don't think I. Oh, there we go.
Yeah,
Cool. 4 hours.
So that is the section where you can see that there is the 4 hours of training required for that section.
I see. Thank you very much.
And that would be for every renewal.
Do you have any other comments, Dr. Rogers?
That's my only question at this time. Thank you.
Okay. I'd like to open it up to the public for public comment. Please feel free to unmute yourself.
Hi, this is Dr. Joe Linder-Crow with CPA. Ms. Sorick or Mr. Glasspool, I know I've asked this question before, and thank you for always responding, but can you just give an update as of today? Any idea about when you would anticipate that these regulations would be ready for implementation?
I can provide an update, not necessarily about when they'll be ready for implementation, but I can tell you where they are right now. They have been sent to the Office of Administrative Law. They're going to be in the notice register on October 2nd, which will start the 45-day comment period. So as soon as they're, and I've already sent a request to put all the information up on our website. So as soon as it's posted on our website and right around October 1st or the last day of September, I'll put the package in the mail, and on the 2nd, I'll put a listserv email together for all of our licensees and public that have registered about the opening of the comment period.
and Mr. Glass-Steagall,
Did you say November 2nd, Mr. Glass-Steagall?
October 2nd notice
October
register.
2nd.
Yep,
Okay.
and that starts the 45-day comment period.
Okay.
Mr. Glass-Steagall, is a hearing scheduled for that reg package?
Yes, I believe it was mentioned earlier that there will be a hearing for that package specifically at the November board meeting.
Sorry, I must have missed that.
No, you're fine.
So this is Dr. Linder-Crow again. Ms. Sork, so you're talking about, are you talking about changing the cultural diversity requirement, or just talking about sort of defining for licensees what that would look like? What kind of, it's not a course, it's 4 hours. And so I just want to go back to what you were talking about the written materials.
So I think it might be helpful. One of the things that, we see now is there's a 4-hour law and ethics requirement, and that's pretty broad in general. I think it might be helpful to let folks know some examples on how they can meet this requirement, while also it can be a twofold thing. It can give examples on what are examples of coursework or areas that would qualify, and then also encouraging individuals to, about the benefits of this requirement and what that looks like. So it's educational and hopefully helpful to give individuals guidance on how they can meet that requirement.
Okay. And then just one more question, going back to the timeline. If this goes out for 45-day notice on October 2nd, again, could you, I mean, and I'm talking in very big chunks. Would we anticipate implementation anytime during 2021? I didn't think so, but I just would like to confirm that.
There's a possibility that this could be submitted and approved by the Office of Administrative Law within 2021. Absolutely. My assumption is we have the hearing in November. After that, it'll take, and this is assuming there's no modified text or anything that has to be sent or anything like that. It would be, a couple, maybe a month or two to finish the regulatory documents and then start the Department of Consumer Affairs secondary and final review process, which I could give it 6 months, or so to get that through. I would say that's a fair guess, I think. And then at that point, we would submit it, and they, depending on their review time frame, right now, the Office of Administrative Law generally has 30 days to review a final rulemaking package, but it's been extended up to 120 days due to the different executive orders. I think one was COVID, another was fires, another was like air quality. So they have, I think right now, up to 120 days. So it could be towards the end of 2021. It could be a little earlier. Could be the beginning of 2022, potentially as well.
Okay, thank you. That helps me in responding to. Sometimes, for whatever reason, this topic kind of comes up again on our listserv and with groups.
And I don't know if this is helpful, Dr. Linda Crow, but I think in the language we had that kind of straddle language to give people the opportunity to go with the more traditional 36 hours if their renewal fell on a certain period. So we've got that flexibility that we wrote into the language, and I think you were there for that exhaustive.
The exhaustive discussions. Yes, we did discuss, and you built in the overlap, a period of time during which people can either follow the current regulations or the new regulations, and then after a certain date, everyone would follow the new regulations. That's correct. That's what I remember. Okay, thank you.
I have a comment again from ASPPB. I have been in a meeting all this morning, and actually I'm going to be going back to it after y'all finish talking about this agenda item, but it's with the education and training community throughout the United States and Canada. It's a big meeting of all the training councils, and the theme of the meeting is social justice and weaving social justice into basically every aspect of training. And one of the ideas that in one of the small groups I was in was to include this in some kind of way in CPD requirements or CE requirements. So I was very excited to say, well, California has this piece going through in there, but it was the focus was on social justice, the broad, that broader issue of social justice. So I'm really glad to see that in the CPD requirements, just in terms of what people are talking about, it's really the larger social justice issues. And I'm glad to see and that they're in California CPD possible regulations. So that's all I had to say.
Thanks, Dr. Horn. Any other public comment at this time? Please unmute yourself. Okay, I don't see any other public.
I do have just one other question. I'm sorry. This is Dr. Linda Crow. Just one other question about for Ms. Sorick. You mentioned here in letter C, that you were, this is to engage the DHCS in regarding Medi-Cal reimbursement rates. I don't think I remember the board being necessarily involved in discussions of reimbursement rates. Can you just talk a little bit more about what the goal would be there?
I think as we talked about, addressing this issue and access to psychological services in California, one of the major things that came up was just access to care in general. And so, when we look at digital divide and individuals that utilize such services as Medi-Cal, what are the oversight agencies that, play a part and a role in determining that access? And with Medi-Cal, the discussion was, what are the current reimbursement rates? And for example, right now, if you go to a 50-minute session with an adult, and it's $18 for that 50 minutes. So our discussion was, not only, is this going to allow for access to care for consumers, but also, is there enough of an incentive with it being $18 for licensees to provide that kind of care with student loans and everything else that's going on? And, not that the board would, look to change the policy on that, but it was just determining how is that rate determined? So is it regulation? Is it statute? Is it part of the budget process? And as you all are aware that are on the line, California is not in a fantastic budget situation to begin with. But at the same time, these are important discussions to have. So if there are opportunities, if there is a budget trailer bill or something and you guys are following it, or something of that nature, if there's an opportunity for the board to engage in that discussion or be supportive when it comes to access, that's kind of how that came up. I don't know if that answered your question.
Yeah, it does. And of course, these are the very issues that CPA works on all the time. And we also coordinate with our national organization in advocacy work on reimbursement issues. A lot of this flows down from CMS, and what the rates that CMS sets are highly influential, not only with private payers, but also with the state as well, and Medi-Cal in particular. So if there are, if there's information that you ever need, or if you just want to, find out kind of what's happening at any given time, we're happy to help with that as well, because these are top level issues for us much of the time around reimbursement rates, of course, both from both the two perspectives that you have just mentioned. One is access to care, and the other is whether or not we can maintain a sufficient number of licensees who will stay in the pool to provide services through Medi-Cal or Medicare, given the fairly low reimbursement rates. And so, this is very high on our radar almost all the time.
Thank you, Dr. Linda Crow. Is there any other public comment on this item? Please feel free to unmute yourself.
Hi, good morning, everyone. My name is Luis Aguilar, a doctoral student, also committee member for the Social Justice and Advocacy Committee for Hispanic Neuropsychological Society. This question goes for Mr. Glass-Steagall. Sir, I know that you and I have had conversations in the past. You had mentioned and shared with us the 18-page document that you pulled up on the tab. I was hoping to see if that was available to the public at this moment.
The continuing professional development regulatory documents will be up on our website, I believe, next week. I've sent them over for the department to post. Other than that, to access the documents, you'd have to go to the board meeting materials from the last time they were reviewed, and I can identify those and send them to you after this meeting if I haven't already done so.
That would be great, sir. And I think that the one that is calling my attention the most is that document you pulled up, because it did address the language quite clearly, and I was hoping to look into that a little further. And my second question, if I may, you all had mentioned an individual, I think if I captured that person's name correctly, was Dr. Gallardo, that contributed to the language used in the framework. Is that correct?
Yes.
What is Dr. Gallardo's first name, if you don't mind me asking?
Miguel.
Miguel Gallardo, perfect. Thank you very much. I appreciate that. And if Mr. Gallardo, is he still associated with a particular organization at this moment?
He's not a current board member. I believe he was a faculty member, and he might still be at Pepperdine, but I don't know if he still is or not.
Not a problem. Thank you very much. I appreciate your time.
No problem.
Thank you, Mr. Aguilar. Any other public comment at this time?
On E, we had talked about, because it was the only item that there wasn't kind of some clearly defined follow-up, but it's been kind of an ongoing theme, an ongoing issue. And in talking to Mr. McGuire, our new legal counsel, we had talked about, what in an ideal world, we would have the staff to write a white paper on this, and it would be helpful and useful for both consumers as well as our licensing community. But knowing that we don't have that kind of staff, are there any options or ways in which we can solicit this kind of research or study in the community, in the educational community? I'm just not sure what our options are here, but I'm sure it's an option. It's an item that's on everyone's radar, and I'm not sure where to go with it, but it would be great to have something that we could put on our website that we could reference back to when we talk about this issue.
Ms. Parker, do you mean the digital divide piece?
Yes.
I think the digital divide piece is something that we're going to continually keep bringing up. But I do like the idea of having something that people can reference. I'm just unclear about how to, obtain that information and put it on the website.
And this is Will McGuire, board counsel, just chiming in because Antoinette referenced my kind of brainstorm idea just to share with the group. This is not in particular like legal advice. It's just kind of, me thinking out loud of how to perhaps find something that might get smarter people than me's, brains going. But what this committee could do is make recommendations to the full board. And what it could recommend potentially that the full board do is put out a solicitation of some kind for, and publish it in all the various channels that the board uses to communicate with the greater public. And it could just say, we're seeking comment on the digital divide from any interested stakeholders. Submit your comments or proposals by X date. And that's just an idea. It's something that is in the power of this committee to do, and then ultimately the board could adopt to actually do such a thing. So if that's something that the committee is interested in, it could consider a motion to recommend to the board, something like that.
One other option I just kind of thought of, and we've utilized this in the past, is maybe putting together a survey where we can compile, what are the challenges, what are the barriers, what are the issues that are creating this digital divide, and then solicit input from all of our stakeholders. And that way it's not necessarily that we're writing a study or writing a background, but we have put together a survey which takes input from, people from all over the community. That it's just another thought I just thought of, so.
Would you need a motion to put together a survey?
Not necessarily. I mean, staff, you could talk with staff here and there if they're willing to do that work, and Antoinette could speak to how their internal processes work. But if it's sort of a recommendation for the board to put that survey on its website once it is created, at this point it's not even created. So I think maybe we're one step, if we're going the survey route, probably want to be created first. Of course, there's no harm in making a motion that says, we recommend that the board post a survey on its website. Well, once that survey is created, I mean, there's certainly no harm in doing that. And maybe Noreen would disagree on the line, but I don't know.
No, I think if there's a specific recommendation for an action, particularly where there's an expenditure of significant expenditure of staff time, or certainly financial resources, you might want to be more formal about it. But I can't quite tell if we've met that threshold just yet.
That's a good point. Antoinette would probably know better than any of us what type of financial impact that might have.
Okay, so maybe we're still in the phase of discussion with board staff and discussing about how to create something like that versus implementation.
One possibility that I'm just kind of throwing out for the committee to consider is if you like the idea of a survey route, we do have, I think we have Mr. Perez on the line who used to work with Solid. The Department of Consumer Affairs has a contract with SurveyMonkey that we've utilized in the past. And we would put together the questions and then they would put it in the SurveyMonkey format. And then I would just take that raw data and be able to provide it at the board level. If that's the direction this committee would like to go, what might be helpful is to ask that I be able to work with the two of you on creating the survey questions to understand that we can really maximize the questions to get the information that we're looking for to address this issue. And then so that would be perhaps a possible motion, is to request that the board support this committee working with myself to draft survey questions to understand this issue. And then not necessarily that we couldn't, after we get the survey data, to then put out a request for educational institutions or nonprofit organizations to study the issue once we get some of that data back. Just throwing that out there.
I'm happy to make that motion. Dr. Rogers, do you have any comments or thoughts?
No specific comments. I agree with everything that has been said, and I'm in full support of working with Ms. Sorick on this. So.
Okay, then I'm happy to make the motion that the Outreach and Communication Committee work with Ms. Sorick on studying the digital divide further with the goal of creating a survey for our website. Does that cover it, Mr. McGuire?
Yeah, I think so. I would double check with Noreen that the way it's written here on our agenda, that it, adequately contemplates this type of motion. I mean, it lists the topic that we're going to be discussing, and our agenda does say that any item that action can be taken. But since we have the benefit of Noreen's expertise here, would you say that this motion is properly made before us, Noreen?
I think the motion is appropriate, proper, because there is notice on the agenda that action may be taken. What I think the action is, though, is a recommendation to the full board. Is that correct? The action that the motion anticipates is recommending to the full board that the committee continue to work with the executive officer?
Yes.
Okay. The only thing that I would point out about that is I'm not quite sure if you're suggesting that the work continue to happen at noticed meetings. Because if you have the two people on the committee working with the executive officer, those would have to be noticed. So just before you formulate the recommendation to the board, I just would want you to know what the what the potential outcome of that would be. So I'm not entirely sure what was contemplated.
Ms. Sorick, thoughts?
We don't have another outreach committee meeting for some time, but it's not like this issue is going anywhere anytime soon, I don't think. So perhaps between now and the next meeting, I could at least share a draft to both of you, and then it could be fully discussed at the next committee meeting.
That sounds good to me.
That sounds fine.
Okay, so we have the motion. Do I need to change my motion, or as it stands is workable?
It sounds like there is, Ms. Stark, are you suggesting that the motion be changed? Or are you just suggesting that before the next committee meeting, you will send something to individually to the committee members? And, I'm sure the committee members know that they cannot talk about it amongst themselves outside of a notice meeting.
Right. It's twofold. We want to bring this item to the board and, get approval from the board to move forward with creating a survey at the committee level. And then between now and the next committee meeting, I'll work on a draft, and then we can discuss the draft questions at the next committee meeting, and then be prepared at that time to send the survey out. Does that seem to capture, Drs. Rogers and Tate, what we've talked about?
Yes.
Yes.
Yeah. Nope, it does. Do I need to change the motion?
I don't think so. Maybe for clarity, if you could restate what the motion is, and then we can have public comment for the vote.
Let's see. Now I got to backtrack. My motion would be for the Outreach and Communications Committee to work with Ms. Sorick prior to the next meeting. Regarding beginning to to formulate a survey for the next meeting if we're presenting it. Did I talk over myself too much?
I don't think so. I think that captures it.
I tried to make it simple, but it may have not worked.
So long as the note taker is clear.
Sarah, did you get that?
Thankfully, this is being recorded.
Yes,
so
it
we
is
can-
being recorded, but I
can
have a
replay
few
it
different
later.
drafts of that.
Okay.
I'll figure it out. Thanks.
Yes. Okay.
And if I can just clarify one thing, just so I'm certain, the motion, and feel free to chime in and tell me if I'm wrong. The motion is that the Outreach and Education Committee makes a recommendation to the full board to complete this survey, which that will take place before the next meeting. So then after the next meeting, after the next board meeting, right, the board will then hopefully approve the motion and direct the Outreach and Education Committee to work with staff to complete the survey. And then at the next Outreach and Communications Committee meeting, that survey will be able to be sent out with a draft prior to that in the meet. I'm sure sent to the committees and then something in the meeting materials. Am I correct?
You're almost right. So the board is going to approve whether or not they want to proceed with doing the survey, and then task the committee with developing the survey with staff. And
Yep.
that development of the survey questions will happen at the next committee meeting.
Yep. Okay, perfect.
And to
Sarah,
further
did you
clarify,
get all of that?
I think so.
to
Okay.
further clarify, this is Will, are we planning to add this item to November's board meeting agenda, or are we contemplating a future 2021 board meeting?
So this item is exactly how it's listed on the agenda today for the November meeting. On digital divide, how does the digital divide impact access to telehealth? So the action that's going to be requested of the board, because I think the header on all the committees is consideration and possible action, is to delegate to the committee to work with staff on developing the survey.
Okay.
Okay, so there is a motion on the floor. Oh. Can everyone hear okay?
I wasn't sure if that was a member of the public who's trying to.
Yeah, there was a lot of static for a while. So, or did you ask for public comment?
No, I just said there's a motion on the floor. I just if I'm getting feedback. Okay.
Yeah, everything's breaking up a little bit.
Okay. So I have a motion on the floor and I'm looking for a second.
I second.
Thank you. Any discussion amongst the board members, please?
I have no comments or questions at this time.
Thank you. I'd like to open it up for public comment.
Yeah, this is Dr. Linda Crow. I just have a question for clarification. I'm not clear on who this survey is intended for. Is this a consumer survey, or are you talking about sending a survey to your licensees asking about the digital divide?
That's something we will cover in our next committee meeting once we draft the questions. My initial thought is that this would be something that would be sent to our licensees, to consumer groups, and to nonprofits or educational institutions that probably have the subject matter expertise on this area so that we could get some valuable feedback.
And that was my thought process as well.
I see. Okay. It seems like before you can draft the questions, you might have to narrow down who it's going to. I mean, if you ask licensees, are you asking them, are they experiencing a digital divide, or are their patients experiencing a digital divide? You see what I mean? So it would be kind of, it seems like you would frame the questions in a bit of a different way.
Ms. Sorek, do you have a response or?
I agree. Typically on issues like this, we would probably ask, I am a this, I'm a that, I'm a whatever as kind of the identifier, and then there will probably be questions that are targeted towards consumers and licensees, and people in the education community or nonprofit community that tangentially are connected to this issue. So in my mind, I'm not seeing this as only getting the perspective from licensees, but getting kind of a broad perspective just to gather data.
And you are focusing it on telehealth and not on the digital divide in online learning necessarily. You're focusing on telehealth, access to telehealth. Is that right?
Correct.
Okay. Thank you.
Is there any more public comment on this item? Please feel free to unmute yourself. I am not seeing any public comment, so we can vote. Ms. Marks, do I need roll call or ayes would do it?
Well, for a teleconference meeting, roll call is required.
Okay, thank you. Mr. Glassbeagle, can you call the roll, please?
Yes. Rogers?
Here.
That's an aye, I believe.
I'm here, and my vote is aye.
Perfect.
Thank you.
Tate?
Aye.
Motion passes.
Perfect. Thank you so much. Was I on mute that whole time?
You were, and I was wondering if it was my system freezing, so I'm starting to worry.
Oh my gosh. So this leads us to our last agenda item, number 14, recommendations for agenda items for future committee meetings. The committee may not discuss or take action on any matter raised during this public comment section, except to decide whether to place the matter on the agenda of a future meeting. I'd like to open up for public comment regarding this agenda item. Please feel free to unmute yourself. I am seeing no public comment, kind of waiting. Okay, so before I adjourn our meeting, I'd like to thank everyone for attending and for all of the helpful comments, and I hope to see you at our next Outreach and Communications Committee. I'd like to make a motion to adjourn.
I second.
Thank you so much. Our meeting has been adjourned, and I hope everyone has a great weekend.
Thank you.
Thank you so much.
Bye-bye.
Okay, thanks.